Now, Health Matters, brought to you by St. Michael's Emergency Rooms.
Each year, 1 in 4 children will be hurt badly enough to need a doctor's attention. And did you fall with your arm out, or did you fall on your shoulder?
I dove for the pylon and I got hit on my shoulder.
If your child has hurt themselves and they are in a lot of pain or unable to use the extremity, such as walking or riding, it is best to seek medical attention immediately.
The school nurse had called us and told us that he was in severe pain and pale.
If your child has injured themselves and you're not sure if it's broken or just sprained, apply ice to the area and immobilize the injury as soon as possible. In an injury, remember the acronym RICE: rest, ice, compression, elevation. Rest the injury, ice to the area, compress the area with a bandage of some sort, and elevate the injury higher than the level of your heart. Point with one finger where it hurts the most. In most cases, we will need an x-ray to determine whether a bone is broken or not. So here's the clavicle, and this is where it's broken, right here and here. And these two portions are actually supposed to go right on line. X-rays can help to determine the severity of the injury as well as possible treatment plans. Some bones may need to be set to heal properly. They can be done immediately or sometimes delayed. But he'll be in some type of device to keep him from using it, maybe up to 8 weeks.
Hopefully I'll be up and going. I don't want it to ruin my baseball career. That'd be bad.
With daylight savings and spring being around the corner, we will see an increase in childhood injuries due to the increased activity outdoors. Make sure your children are using the proper safety equipment, especially helmets while riding their bikes. From St. Michael's Emergency Rooms, I'm Dr. Shannon Orsak.